Hello and a very good evening to all our viewers who are joining me in this live interaction on News 9's Facebook as well as YouTube page. And today we will be speaking about the importance of wearing masks indoor. Now, a new study by Simon Fraser University researchers has found clear evidence that wearing a mask can have a significant impact on the spread of COVID-19. Now, the researchers from SFU's Department of Economics have determined that mask mandates are associated with 25% or larger weekly reduction in COVID-19 cases. Now, the findings of their study concludes that mandating indoor masks nationwide in early July could have reduced the weekly number of new cases in Canada by close to 25 to 40% in mid-August, which translates close to 700 to 1,100 fewer cases per week. Now, if we take this as an example and also related to India, even in India and in Karnataka especially, last week I presented to you a particular piece of information where I told you that in Bangalore there are indoor infections and these cases are on the rise. Now, to give us more insights on how wearing mask indoors could probably help us contain COVID-19, we have with us Dr. Sitesh Roy joining us live from Mumbai. Many thanks for joining me in this live interaction, Dr. Sitesh Roy. Do you think that wearing masks indoors could probably reduce the number of COVID-19 cases in the country, Doctor?
Yes, Deepak, I think this is something that we need to take seriously. And there are certain situations in which this becomes even more important. Why I mention this is because it has been known from the very beginning of this pandemic from China that cluster spread of the SARS-CoV-2 virus within families is one of the most prominent way that this virus claims more and more new susceptible bodies to infect. What happens is generally if a family member is coming down with an infection of SARS-CoV-2 and has very mild symptoms, and if they choose to ignore it or if they choose to not take the right precautions or steps, then within the first 1, 2 or 3 days, just by interacting with the other family members or roommates, if it is a group of people staying together, that person can easily spread the virus to others. And so while saying that everyone needs to wear a mask when they are indoors becomes a bit too much, but I do believe that if there are unknown people who are together indoors, then there need to be wearing of masks, such as in offices, workspaces, if someone is going to any kind of a restaurant, it becomes very, very important. And more so if anyone in the family comes down with a fever or a cold or a cough or a runny nose or is having the earliest signs of what might be a SARS-CoV-2 infection, then not just that individual but also everyone else in the family needs to immediately start wearing masks, maintaining physical distancing, and while that person gets evaluated appropriately medically, even maintaining quarantining becomes very important for that person.
Now, Doctor, this particular study is with respect to the cases in Canada. Do you think that, if people in India wore masks when they were indoors, do you think that the number of cases that we have today could have probably been 25% lesser?
I would believe even more than 25% given the population of this country and given the rate at which we got new infections, almost at 95,000 per day at one point. I strongly believe that if people wear their mask correctly over their nose and mouth and keep it clean and maintain it properly and use it when they are around even one other person, even if it's a known person, I do believe that the infections can be reduced, and wearing it indoors at workplaces, even if you're around people you know. So what ends up happening is people emotionally believe this is my friend, this is my family member, what I need to maintain any kind of distance or maintain any kind of precaution. But in today's day and age, every single person can be an asymptomatic carrier of this virus. That's a fact. And so, with that kind of a fact in mind, if we take extra precautions till we have vaccines, till we have other forms of protection, I think it would make all the sense in the world. And I believe India can also cut down its infections. It is well known that if 90% of the population wore a mask, we would cut the spread of the virus and we would tame the tide of cases that we are seeing significantly and flatten the curve.
Now, doctor, all these days, when a person enters his or her house, especially after, traveling around the city, one would be advised to, just follow hand hygiene. But now, this particular study in Canada has indicated that even though you go out, come home and then wash your hands and maintain a good hand hygiene, wearing a mask indoor is also very important. So many people do not know about this. So what would you like to tell all those people?
So, as I said, mandating wearing masks inside the house for every single person who's going out all the time, I think maybe a little too restrictive. And I don't know how far it will be practical. But if a person, for example, is a healthcare worker and interacts with patients who potentially have cough, cold, fever, can have SARS-CoV-2, then those people might even want to consider wearing a mask in their home because they may get an asymptomatic infection. Also, individuals who are traveling in public transport or in crowded spaces, they also might want to consider. And I think the main message here is if you have the slightest symptom, a little loss of taste, a little loss of smell, a little fever, feverishness, a little bit of a cold, blocked nose, sneezing, slight cough, itchy throat, scratchy throat, anything that may suggest that you're coming down with a viral infection, please wear a mask inside your house also. You'll save yourself and you'll save your family members and colleagues at work.
Well, many thanks for joining me in this live interaction, Dr. Sitesh Roy. Well, like you heard it from the doctor himself, mandating the family members to wear a mask is very important because like the doctor clearly mentioned that if a person in the family is a doctor and he interacts with patients every single day, then he is very much obligated to wear a mask at home because you'll never know which kind of a patient that that particular family member met, and you wouldn't want to carry that particular risk back home where you want your family members to be safe. So in order to avoid giving rise to COVID-19 cases within the four walls of your house and within your family members, all make sure that it is not just about hand hygiene, but it's also about wearing a mask if you have the slightest of symptoms like Dr. Sitesh Roy mentioned. So wear a mask if you have the slightest of symptoms of COVID-19, and don't forget to get yourself tested if you ever come across a itchy throat or a running nose or even a feverish symptom. So make sure that you are safe and also ensure that by wearing a mask you will keep the lives of your loved ones also safe. So if you guys have liked this piece of information that we've shared with you all, please drop in your comments and also like, share and subscribe to News 9 on various social media platforms. Many thanks for joining us.